Hi, welcome to my channel. Stephanie T here. I'm creating this video because I wanted to document and share my double jaw surgery experience with the jaw surgery community here on YouTube. Anybody who is just curious about the process, or anyone who just likes to watch this type of thing for whatever reason. So today is January 30th, 2021. My double jaw surgery journey started in March 2020. So in March, right before the COVID-19 pandemic hit the US, I decided that I wanted to get braces. I had already been thinking about it before. I had a consultation with a doctor here in Arlington, Virginia, and I was like, okay, I'm just gonna pull the trigger before the pandemic closures hit. And I think that was like the best decision that I could have made at the time. So started my braces journey then. My orthodontist let me know, in my consultation that I would need surgery. And previously, I had braces when I was 15 years old. At the time, they told me with just the way that my bones happened to develop that I would need jaw surgery. So it's something that I've had on my radar and known about for a long time. I did kind of just push it aside, when I was in college, obviously not working a full-time job, having my own insurance to cover this type of thing. Whereas now I'm in the position where I can do that. So yeah, it's been a pretty long journey. So what actually led up to all of this was in around November, December 2019, I had actually lost my retainer. So even though I got braces when I was 15, I kept up with that retainer for over 10 years. It sounds kind of gross. I kept up with that retainer for a really long time, up until I lost it. I think I accidentally threw it away. So yeah, it was long gone, and quickly, within a week or two, my teeth started to shift back in the position that they were in before I got braces when I was 15 years old. So I was like, okay, I have to do something about this. And that's when I, just did my own research on orthodontists in the area. And I came across a doctor here in Arlington, Virginia. So I've been going to see her. It started off at about every 6 weeks because I have had braces previously. My teeth weren't in too bad of a position. And so the, malocclusion that I have is class 3, which is a medical term for underbite, where my top teeth don't meet with my bottom teeth. They're a little bit behind, so that's the condition that I had initially. And fast forward to a few months of having braces, and now I have a little bit of an open bite as well, meaning my back teeth will be touching, but in the front of my mouth it's more open. So before I had braces, so your mouth changes during that process. My front teeth were behind my lower teeth. And so now it's still behind, but instead of, coming down behind, it's kind of like on top. Still back, but on top and not down, if that makes any sense at all. So it's been quite a journey. I remember my first few months having braces, I barely got any sleep at night because I would just wake up consistently really, really early in the morning, middle of the night, because I was grinding my teeth, or, I was very uncomfortable, and I just honestly, couldn't really sleep due to that. So it's definitely been a journey. Fast forward to now, like I said, it's January 2021, and I have been going to the orthodontist not as frequently because my original plan with my orthodontist was 12 months with braces. You'll have your braces on for 6 months. At the 6-month mark, I was supposed to have the double jaw surgery procedure. That didn't happen for a couple of reasons, one being COVID and some miscommunication between my oral surgeon and my orthodontist office. So my surgery got pushed back quite a bit, which was a little frustrating and then very nerve-wracking with this COVID situation, and things pretty much change seems just to be about every day. So things right now are, I guess, pretty somewhat maybe stable in the area that I live in, as far as the hospital that I'm going to be getting my procedure done at. So I will be getting my procedure done at a hospital. That's where my oral surgeon's office is. So all of my appointments that I've been going to, all my pre-op appointments have been at a hospital. So yes, there are some hospital and facility charges as well as physician charges. That's what comes along with that. But the good side of that is I don't have to find an aftercare center to take care of me after surgery. So the plan so far is I will be in the hospital for one night, and all goes well, I'll be discharged the next day around 12 p.m. So my surgery date is February 8th. 2021, which is about 9 days from now. So it's coming up pretty quick. I'm really excited, also very nervous because, obviously I've never had anything like this done before. So it's definitely going to be a real adjustment for me. I've watched some different videos here about recovery here on YouTube, which, helped me learn what to buy and things like that. To prepare me. I know it's going to be a pretty good challenge, but I do have pretty strong support. My mom's going to be coming up here to help me out with my recovery for a short period of time, so that'll be really helpful. But yeah, so I actually have my orthodontist appointment where I'm going to get my surgical lugs or surgical hooks on Friday. My surgery is on the following Monday, so it'll be interesting to see how, that'll impact my eating and things of that nature. And I do have another pre-op appointment this week, just my final physical from a doctor that will tell the surgeons that I'm good to go, I'm healthy, my blood tests are good, things of that nature. So once that's done, I've done all the other prerequisites for this process, I should be good to go. So it's nerve-wracking because, there's all these things going on with COVID, and you kind of feel like, am I really going to have it this time? Because I kind of, did feel really discouraged and let down when my surgery in September got postponed because they didn't even have a next date for me. So I was like, okay, is it going to be in November? I knew that December looked pretty bleak because of, the holidays and COVID, and, it takes such a long time to get these surgeries scheduled due to the doctor's schedules, and the operating room is pretty limited due to COVID. So I'm really grateful and thankful that I'm able to finally have a surgery date that seems to be pretty solid. So fingers crossed, nothing's going to change there. So yeah, this is just, I guess, my intro. I'm really looking forward to sharing more, documenting more. I haven't really been documenting inside of the hospital at any of my pre-op appointments, but so far I've had several molds and models taken of my mouth. I've had all of the measurements where, they measure you from here to here, your nose, your mouth. They pretty much measure your whole head. I've had several x-ray images taken, several pictures taken and things like that. So I also have some before pictures from my orthodontist that'll show before I even got braces on. And then they also took some pictures of me before before my final appointment there. So my last appointment at my orthodontist is when I got my power chains. So lucky me. If you've had braces, you know what I'm talking about. Power chains are awful. And when I had braces the first time, I had never experienced power chains. So it's definitely something different. Power chains are basically just used to get your teeth tightened together and straight a lot quicker. because, you know, they're trying to, I guess, sort of speed up this process for me. Like I said, it's kind of been a long time coming. It's been pushed out several months, so I'm really looking forward to, you know, documenting and sharing more. Hopefully when my mom comes, she'll be recording for me, because I'm sure I'll be probably a little out of it for a day or two, but I'm gonna try to document as much as I can of that process. I know that'll take some real opening up and vulnerability. I'm a really private person, so this is pretty different for me, but I'm definitely excited. I'm looking forward to the after recovery period. So my doctors told me that I would have about a 6 to 8 weeks of non-chewing diet, or you could say a blenderized diet. Pretty much most things I'm gonna have for several weeks are gonna be liquids, but I've already started to stock up on like protein drinks, which I can share with you guys in another video of what I got. Just some things that I know I can make that I can fit in a syringe and a ketchup bottle, condiment bottle, whatever you want to call it, or I can pretty much just squeeze it in my mouth without, you know, trying to use a spoon or anything like that. So yeah, so I guess this concludes my intro. Welcome to my YouTube channel again. Hopefully you guys will find something useful here or interesting, and you will continue to watch my content. So thanks.